Yes, respected Dr. Datta Bhatt sir, Dr. Samir Sadekar, and all at Directorate of Health Services, and also all the medical officers who are working hard in this difficult time at their respective places. Uh, Good evening, good afternoon to all. Um I think what I will be speaking is it will be like a discussion. I will first of all I will tell some of my experiences or some of my views, and then if you want you can ask your questions, specific questions, and that also we can discuss. So first of all, uh, in brief, I will tell my views about what we can think from Ayurvedic perspective about this problem. So in when such viral or any other kinds of infections, Ayurveda is having its viewpoint. Ayurveda is having its own viewpoint, and Ayurveda recognizes the microorganisms, but along with destroying those microorganisms, Ayurveda gives more importance to protect our dhatus, our body tissues, and that is most important. So what we can understand that whether from the medicines we are giving, this virus will be destroyed or not, that we can't say right now, because we don't have any evidence or researches are going on about certain medicines, Ayush medicines. On certain Ayush medicines, researches have been completed, and it is found that it actually acts on that virus. But rather than acting on that virus, what we are thinking is that when that virus comes in contact with the human body, the effects which we observe, they are like a kind of poison, and that's why visha like, and that's why they are affecting our various functioning of the various dhatu, various body tissues, and then later on it can pose threat to even life, because it is a kind of visha is produced in the body, and various tissues they are affected. Sometimes the tissues they are so much affected that they are as if destroyed, and that can be called in Ayurvedic terminology as dhatu pak. So what we will think this as a kind of vishajanya jwar. And in Sushruta Samhita, in Charak Samhita, all texts they have mentioned about Vishajanya Jwar. That means when Visha like substances we inhale, or in other ways also they come in contact with the body, what kind of effects are produced in the body. In Sushruta Samhita, in Dalland commentary, they have specifically mentioned that when a Visha comes in contact with the body through nasal route, then which symptoms are produced, and many of them resemble the symptoms which we are presently observing. Along with that, they have also described that through skin, if the poison enters into the body, then what kind of symptoms are produced. That is also mentioned in our texts. So Vishajanya Jwar. So then, if you'll find about Vishajanya Jwar more details in various texts, we find various details, and specifically in texts like Bhav Prakash or Vangasen, they have described the treatment for Vishajanya Jwar, and in that they have mentioned one specific yoga, and which we are using in our practice, and that is called as Sarvagandha. And it is not very difficult to prepare. Majority of the ingredients are already available, not only in medicinal stores, but in general market also. Some of these medicines are available, like Bhimseni Karpur. So Bhimseni Karpur is available in the market. This I'm not making advertise of any particular brand, but this Sanatan Samstha, which the camphor which they sell for puja, it is Bhimseni Karpur, and that we can advise people. That means carefully, of course, to use internally when it required, or we can take that and give in specific dose to the patients. So that is one of the ingredients. Kankol, lavanga, dalchini, etc. List of medicines is described for that, and the combination of that is called as sarvagandha. It is acting very good in that. Now, jwara, and then later on, the person sometimes he develops difficulty in breathing. So we will think of a kind of Sannipatik jwar is produced, and Upadrav of that will be Shwas. So Upadrav of jwar Shwas. So Shwas as Upadrav of jwar. Like that also description we get in the text, and for that also they have described specific formulations. Like for example, the one Dashanga Kwath is mentioned, one Twatriushat Kwath. This I am just giving as information for you. Practically, from all this, what we can use, that also I will tell. But this is for your information for your further study. Just you will be knowing what is mentioned in Ayurveda. So, Shwas originating due to Jwara, like that is described. And then other conditions like difficulty in breathing, then uh, Sannipat Jwar, and difficulty in breathing, like that. Many senior Vaidyas, they use the term Shwasanak Sannipat for pneumonia. Although classically we don't get much description about this way, so Shwasanak Sannipat. The names given in original texts are different, but for practical purposes, we can adopt this name. There is no harm in adopting this name. So in many of these patients, what we find is that initially when they get jwara, then they have body ache, or that temperature, what we observe, the symptoms along with that, headache, body ache, etc., what we observe, more of Vat Pradhan Jwar, the symptoms we observe. And that's why we are using Mahajwarankush mainly in that Jwar. But Tribhuvan Kirti is also performing similar action. So actually Mahajwarankush in Vat Pradhan Kaphanubandhi Jwar, and Tribhuvan Kirti in Kapha Pradhan Vatanubandhi Jwar, but quite similar actions. So if Tribhuvan Kirti is available for you, you can make use of that. But usually this is like a Sannipatic condition, and therefore any medicines, Kaphavatagana medicines and Ushna medicines, they will increase Pitta. So to avoid that, what we are doing, along with Mahajorankush, we are adding one specific combination called as Sapta Paranadi. But instead of that, you can make use of Mahasudarshan Quats that may be available to you, or Guduchi Ghana or Guduchi. Guduchi is as per the text also, and now also in the last 1 year, the Ayush Ministry has conducted various studies at various centers, Ayush centers all over the India, and in that it is found that Guduchi is quite effective in this pandemic, and that's why Guduchi can be used along with that, so that Pitta will also not increase, but the effect on Jwara will be even better with that. Then what we are doing, I'm telling my experiences, and then practically whatever possible at your level, what is possible, what is available, that way we have to proceed. All the things, my clinic is private clinic, so as per my wish I can demand the medicines, but you are bound by certain rules and certain setup. So whatever you cannot immediately ask for something and you will get something, and you will start using that. Still, I think the Directorate of Health Services is very much cooperative, and they have made you available various Ayurvedic medicines. And I know many of Ayurvedic doctors working at various centers who are using Ayurvedic medicines very successfully and treating the mild and moderate patients. So many medicines are already available with you. So Guduchi Ghanavati you can use for that purpose. We are using Rasamani because Ashtanga Sangraha, in that they have mentioned that Hartal is very good for Vishajanya Jwar, and that's why medicine prepared from that Rasamanikya we are using in these patients. But if possible, you can use Rasamanikya or Samir Pannag. If possible, you can use, because that will prevent the further part of related to difficulty in respiration also. So Shwas also, it will take care of that. So these medicines we are using now. One important aspect which is important from our viewpoint, but many times the modern doctors are neglecting that, and that is how is the digestion of the patient. In even in ICU patients now, see last 1 month I got more than 90 patients I'm treating of COVID, diagnosed as COVID. Some of them were mild, some of them were moderate, and 16 to 17 patients in ICU I'm recently treating. So how that is possible? That is by taking consent of the patient and by taking the permission of the doctor who is in charge over there. Presently, Ayurvedic medicines are, we cannot directly treat the severe COVID patients as per law, but we can request that doctor, if the patient is not responding, of course, to the modern treatments, if he's well responding to the modern treatment, he's well recovering, then we don't need to interfere with that. But if in many patients, it is happening that even with the modern treatment, the patient is not improving, the patient's condition is worsening. So in that case, the patient's consent can be taken, and the doctors can be requested that can we give Ayurvedic medicines along with your medicines. We are not uh, uh, talking anything about your medicines. You can continue your medicines. And even I think in December, the Supreme Court has given justice in that they have said that as adjuvants, Ayurvedic medicines can be used even for ICU patients, but not independently. So with the modern doctors who are treating that patient, their permission as adjuvant medicines, we can use them. Like that, they have said. More details about the law will be known to the Directorate of Health Services. But what this is what I know about that. But with patients' consent and doctors' permission, we can give medicines even to them. So in ICU patients, also what we observed that, for example, one patient who was improving well, suddenly his SpO2 levels dropped to 60 and they were not coming up. And we asked various details, and then we found that since last 4 days he has not passed motions. And the modern doctor said that that is not significant. We are not looking at that. But the patient, if he passes the motions, he feels very much comfortable. And even in breathing, he feels ease when he passes motions. And then we requested those doctors that we gave some medicines also, and we requested those doctors that can you please give some enema, or at least use suppository. Then doctors are allowed to use suppository, and as soon as the suppository was used, the patient passed motion, he felt better, and his oxygen saturations went up to 80. And then by that time, we had given our medicines also, like Trailokya Chintamani, by which his oxygen saturation raised to above 90. So even in the oxygen saturation, this constipation can be linked, have a link. But the modern doctors, they are not paying attention to that. They think that it is insignificant. That is later on that can be seen. After the vital parameters they are corrected, then later on the motions and all we can see. But from our viewpoint, this is also significant. So that's why in almost all the patients, we have to observe whether the digestion of the patient is proper or not. If the digestion is not proper, then at least Triphala we can give, or if Aragvad in the form of tablet, if you are having pills, that can be given, or something like Avipattikar Churnam, it can be given. Which all these medicines can be given in fever, in jwar, and even in when the patient is having difficulty in breathing. One other important thing is Arogya Vardhini, which is available everywhere, and at your place also it will be available. And Arogya Vardhini is also indicated in Jwar. So what we are doing is that Arogya Vardhini we are doing in between the meals, that means Samankal, or before the meals, that means Apankal. And that Arogya Vardhini will help in Jwar also, the Arogya Vardhini will help in improving digestion also, and it will help in having proper motions also. So it is available and we can make use of that. So Arogya Vardhini, Triphala, like that, something if you will give, the patient will he will be having better improvement. That is observed. Another important thing which the modern doctors they probably are not observing is that many patients of them we find there are symptoms of krimi, and in all this situation we tend to neglect that, oh, this factor later on we will see. But you can observe that if you will give krumikutar to these patients in the after the dinner or at the night time, then That also gives very good improvement in jwar, in fever, and in other symptoms, specifically in cough, in dry cough. When you will give krimi kuthar at night, you see the difference. From the next day, the patient will have a lot of difference. His cough will be controlled, because krimi is one important factor, worms is one important factor in even here, because these patients, they already might be having worm infestation, not that because they got this infection, they got worm infestation already, they might be having that. It is observed, it is there are research papers already published that the patients who are having worm infestations, they are having more chances of getting various viral infections like that, not specifically on this COVID virus, but overall viral infections. On that, papers have been published. So therefore, this factor, which is usually neglected, also we can look at this factor. So this will be at the beginning. Then the patients who are having cough, for them, usually these patients, they are spitting the cough with great difficulty. The cough is coming out. That way, the patients we are observing, we are not observing the patients who are having a lot of cough coming out very easily. Not like that. Dry cough usually in many patients is observed, and with difficulty that sputum is coming out. So in such conditions, Talisadi Churna is helping. Why Talisadi? Because Talisadi Churna is from Rajakshma Adhikar, so it will maintain the strength of the person, and it is in the Arochak Adhikar of Rajakshma. And these patients, they are also having Aruchi, loss of taste. So in that also this Talisadi is useful. So Talisadi will be available, I think, with you, but that you can make use of that, and that will help. The patients who are having continuous dry cough, in them Sooth Shekhar works very well. In the Palashruti of Sooth Shekhar, Kas is mentioned, and we are using almost to all the patients of dry cough, this Sooth Shekhar. So that will be available at your place also. So try that. That is helping. We are using Vasa, Haridra, and Kantakari along with that. So you might be having some preparation with you, some proprietary preparation which is having these medicines. So because Haridra and Vasa, they both act on throat irritation very well. They help in moving the cough out. They are useful in cough, and also in breathing difficulty. On fever, jwar also they are useful. So in many conditions they are working. So we are using them. So this is the pattern usually we are following. But nowadays what we are observing is that usually the patients for first 2-3 days, they are having little fever. Sometimes the fever is very mild. But in many patients, it is also observed that the fever continues, prolongs for longer period. It is not coming down. So repeatedly the person is having, that means almost continuously he is having fever. So in such conditions, we have used Rasapachak. You all know about it, and that works very well. That means immediately when we start that Rasapachak, Quath we are giving, but even in powder form or tablet form, whatever form is available, you can use. So that brings down the temperature which is persistent, which is not coming down. That is controlled with this. And what we are observing in this second wave specifically is that many patients, after initially 2-3 days, they might be having very mild symptoms. The fever is also very mild, but after third, fourth day, suddenly they start developing difficulty in breathing, and sometimes they develop pneumonia later on, and their SpO2 levels, means oxygen levels, drop down, and many other complications start after third, fourth day. Initially, they are feeling better. So that's why after observing initial few patients, what we have decided that at right from the beginning, we have to give the patient certain medicines which will maintain the overall strength of the patient and also the strength of the lungs specifically. So for that purpose, one medicine which can be commonly used, which you all know, is Lakshmi Vilas, and that can be commonly used. Those patients who are, we are suspecting that they might get severe symptoms very soon. To those patients, we are giving Mahalakshmi Vilas. Well, that means Suvarna Yukta Kalpa we are giving. Some patients initially only they tend to show the symptoms that they may get severe condition after some time, but they are having fever, jwar, and in jwar, as you know, balya medicines will improve strength. They are not advised in fever usually. So therefore, if this is required still, then what we can use is Suvarna Suchekhar, because that is indicated in fever also. So that we can make use of that if required for any patients. That will not be readily available, may not be available at your place, but at certain medical stores that will be available. And if you want for your patient, you can advise them to make use of that. And Suvarna Malini Vasanta is another. If mild fever is there, then that can be used. Suvarna Malini Vasanta, that can be used for these patients. Now then comes the condition in which actually the patients they are having tending to severe condition, and then the treatment differs. But now what we are thinking is that first of all we should try to prevent the patient to move to the severe condition. If he is already not in a severe condition, we can try that he will not get the severe condition in near future. And for that purpose, as I told, we can start using certain medicines which will improve strength, like Lakshmi Vilas. And therefore we had a long discussion, Dr. Bhatt sir and uh, all of us, we had long discussion. And what we decided, that can we have something for the patient before he gets severe symptoms only, to prevent that condition, then it will be better. Already the government of India has advised Ayush 64, and that will be made available to the patients. It is the Honorable Chief Minister and Honorable Ayush Minister Shripad Naik, they have already declared that that will be given to the patients. And that is a good thing. That will be helping in fighting against that virus, fighting against the fever and other symptoms. But to maintain the strength, if we can add something more to that, that's why we had a discussion. And in that discussion, we thought about various medicines, but we found that one specific combination, it is covering majority of the symptoms of the patients, but along with that, it is improving the strength of the patient also right from the beginning. And that specific combination is available in the name of Nagar Kirti tablets. So what that pharmacy has done is that Nagaradi Kashaya, which is advised by the Ayush Ministry also, Nagaradi Kashaya. So that Nagaradi Kashaya, it is given in the form of extracts, so that they thought that it will be even more potent. So Shunthi, Pushkarmul, Guduchi and Kantakari, their extracts are added in this. So all the good benefits of Nagaradi Kwath, like Kas, Shwas, Parshvashul, Jwar, in all that it is said to be effective. And so all these good benefits will be obtained from this. Along with that, there is extract of Tulsi added to it. So that will add to the benefits. Then next to that, they have added Mahasudarshan Kwath Ghana also to this combination, so that Pitta will not rise, and in Jwar it will be even more beneficial. They have added Tribhuvan Kirti in good quantity, that means 100 milligram per this tablet, along with all these other medicines. And we have already discussed that this Tribhuvan Kirti will be very beneficial to these patients. And along with that, they have added Nardiya Lakshmi Vilas, which will be taking care of the symptoms like Kash, Shwas, Pratishay, etc. But at the same time, it will be improving strength, overall strength and strength of lungs. And Sitobaladi Churna is also added in 200 milligram quantity. So all this, with all this combination, majority of the symptoms, they are taken care. We are using many medicines which were already advised by Ayush protocol, or majority of the experienced Vaidyas, they are using them. So this is a ready-made combination of all these medicines. So we need not search for individual medicines like Nagaradi Kwat, then Tribhuvan Kirti, then Lakshmi Vilas, and then we will mix them, and then we will advise them to the patient. Then 2-3 tablets we will have to give, and the patients usually prefer lesser medicines they prefer. So therefore, for these patients, this combination, we thought that this will be useful for all the symptoms, but at the same time for improving strength also. And why not to give such a medicine before only, so that the patient will not have severe symptoms later on. So therefore, uh, the, the Directorate of Health Services is planning to advise to you that Dr. Datta Bhatt sir will tell you again later on, to give this medicine to you, and that will be dispensed to the patients right at the beginning only, when his report is positive and he's not having much severe symptoms. At that stage only, if this is given, then the further severe symptoms can be prevented and the further complications can be prevented. So that's why it is being planned to give this medicine, and about that later on, Bert sir will tell you about more details about that. But I have told you the medicinal part of that, how it is working. That I have already told you. Now, apart from this, just like I said, that we are not officially allowed to independently treat the ICU patients or critical or severe patients of COVID. But like I said, by requesting those doctors, if the patient is not improving, then with the modern treatment, his condition is worsening, then and you are attending the patient, then you can request to the modern doctors that can we give Ayurvedic medicines along with that. And it is observed that when as adjuvant Ayurvedic medicines are given to maintain the strength of lungs and other tissues, then the complications can be controlled in better way. And in many patients they came out of the ICU, came out of that critical condition also. Some patients they improved, but later on, due to some other reasons, they died also. Not that all 100% patients we are able to save their life. We are not claiming that, but in many patients, good improvement was observed by giving these medicines. So what we can do is that we can request those doctors that can we give Ayurvedic medicines along with whatever treatment is already going on, and it is giving better results as if adjuvant this is given. And then we can take the consent of the patient also, that this way it is experienced by many Vaidyas that if this is given along with that those medicines which are already going on, then better results are observed. So if you are ready, then we can provide you those medicines, and then you can make arrangement to provide such medicines to these patients, Suvarna Yukta Kalpa specifically, and some other medicines, not all Suvarna Yukta Kalpa. Even in patients, there are simple medicines also can be used. For example, we are using Dhatriya Rishta and Dashmula Rishta to many patients, because this Dhatriya Rishta, it is containing a lot of Amalaki. So that's why now the modern doctors may be satisfied that it is containing a lot of vitamin C. But our purpose is that is also there. But our purpose is that this Amalaki will help in good digestion and good motions. Not only that, but this Amalaki is a very good medicine acting on prana as per Ayurveda. So in Prana Kamiya Rasayan, all the Rasayan related to Amalaki are described, and that's why experienced Vaidyas they say that Amalaki is one of the best medicines. Amla is one of the best medicines acting on Prana Srotas, and therefore this Dhatri Arishta it is available in the market, and then that is when it is given Arishta Kalpana, it acts quickly, it can penetrate and it can reach to minute channels very easily, and then it can show the effects of Amalaki and other medicines which are there inside it. That we are giving, and along with that, Dashmula Arishta or other medicines, but certain Suvarna Kalpa, like if fever is not coming down and it is continuously going on, and the patient is becoming weak, his even oxygen saturations are coming down with that. In such conditions, the Jai Mangal Ras if it is of good quality, then immediately it is showing good results. The fever is also controlled, and even the oxygen levels also are improved. That has been observed in many patients. Then another medicine which we can commonly give, already I have mentioned, is Mahalakshmi Vilas. It protects various organs. For Mahalakshmi Vilas, Gune Shastri had said that when various organs, the control of the body over them is lost, and the organs become very weak, and that's why they are not able to perform their functions. That means failure of various organs, and specifically lungs and heart. So on that, this Mahalakshmi Vilas is acting, it is said, and that's why good quality Mahalakshmi Vilas is available with us. Then immediately the results are observed. Some of the other medicines experienced Vaidyas are using in the patients of pneumonia, or those Vaidyas who are they are calling as Swasanak Sannipat. In that, this Makar Dhwaj they are using. So Makar Dhwaj we can use, or Swarna Sindur we can use, which is acting on that, and that will also help a lot in these patients. We have used in many patients. Now, in many of the patients, what happens is that, according to our viewpoint, PARC-like process takes place, and as a result of that, certain factors like D-dimer and other factors are increased, and therefore the condition is worsening. In such conditions, to stop this process of PARC in the body, and to also to maintain the bala strength of the patient, what we are using is Swarnaraj Vangeshwar and Yashad. We are using. I'm just telling you for your information. Maybe all the those medicines will not be immediately available to you, but you can keep in your mind that such kind of medicines help in these patients. And along with that, as I told already, we are using Haridra or Daru Haridra, and then therefore with that also that can be prevented. And when we are giving medicines like Rakta Pachak or Mausa Pachak. So with that also further damage to the tissues can be prevented, and Dhatu Pak from in our terminology, what we call, that can be prevented. So for that, such medicines are very useful. In Bhav Prakash, they have told that in Sannipatik Jwar, in the diet of the in the Anna and Pan, in the diet and in the water which is drinking, Gokshur and Kantakari, these medicines should be added for all the patients, they have said. So Gokshur or Gokshuradi Gugul also we can, that will be available at your place. That can be used also for this purpose. So that can be used. So I think I have told you some of and in very critical conditions, we are using Trailokya Chintamani or rarely Hemagarbha, but Hemagarbha we are not using in many patients. Trailokya Chintamani we are using. That should be Hirak and Suvarna Yukta. Trailokya Chintamani. Why I am telling like that? Because these days from all over India, various Ayurvedic practitioners, some of them who know me by some reason, in their we are in some same WhatsApp group or whatever reason, they know me. Sometimes they are calling us and asking that what you are doing in such patients. I have got a patient, or one of my relatives is having this problem, what we can do. So one patient originally from Kerala and admitted in a hospital in Delhi, and he was in very critical condition, and they wanted advice on that. So what can be done? So we advised them that Trailokya Chintamani, you start at least 3 times today, you give that. But it was not available in Delhi because now people have started using these medicines on large scale, so that it was not available. And so finally I contacted with some of my friends who are practicing in Delhi and asked them that where it can be available, and if not, you may make it available for that patient. So then somehow it was available, but it was which pharmacy is preparing like that, I don't know. Without Suvarna and without Hirak, Trailokya Chintamani was available. Then they said that can we purchase Hirak Basma and Suvarna Basma along with that and mix it and give. So I said that okay, there is no other alternative than do that. So, but what I'm trying to say is that the medicine should be having proper quality. Then it will be giving those kind of results. So we can make available such kind of medicines to these patients. And even I had a discussion with Bhatt sir, and even I had a discussion with Honorable CM sir, and he also thinks that if this way, that means by taking permission of the modern doctors, if they allow and we give Ayurvedic medicines, it will be very good for the patients, because ultimately saving life of the patient is very important. And that's why you are working actually at the field, and therefore you can do this work. So you are yourself representatives of Ayurveda over there. So, and homeopathy. I'm not an expert in homeopathy, so I'm not talked anything about homeopathy yet. So, but you can do at your level, personal level, because you see these things are so much complicated that taking official permission at a higher level and allowing you officially is not immediately possible. Like even in last 1.5 years also, it is not still possible, because it is very complicated process and many things are required to do this. And those things are also concerned authorities are doing. But right now we can get officially this permission, but unofficially, to save life of the patient, at our level we can make such efforts, and we can give such medicines if whenever possible to the patients. So I request you to do that at your level and help to save the life of the patient in this way. I am ready to help anyone who wants my help for this purpose. Whatever experience I am having, I will share with you. Medicines, if you want any of these medicines, I can make them available to you. So you can communicate to me if you want in this regard. Some of these medicines will be already available at your place. Those medicines like this Suvarna Kalpa, all of them may not be available easily. But if you want, you can you can purchase yourself, or you can communicate to me, and we can make it available to the patient. So I think I have put forward my views and my experiences on that. Now, with the permission of Dr. Bhatt sir, if all of you want to ask anything, you can ask. And if Dr. Bhatt sir or anyone else from DHS, they want to say something, they can please tell.
Thank you, Dixit sir.